Senator Tillis, let's really take a look at one of the biggest issues facing our veterans today, that's mental illness and suicide prevention issues. How do we, I don't know if there's a solution to it yet, how do we get to the top of working with mental illness in our military and veterans and suicide issues?
Well, we've made some progress. One thing that we've done that many people wouldn't be aware of, but you have this thing called bad paper. So it could be someone who was discharged with other than honorable. It could have been related to PTS, it could have been traumatic brain injury. We don't know why their behavior changed, but they were a significant group of people who were at risk for suicide. Now the department has issued mental health services for anyone, even without an honorable discharge, to make sure they get the care and we have the opportunity to intervene in a situation where somebody may be at risk of suicide. We're also trying to increase the resources that we have for the crisis hotlines and the ability for a veteran who may be experiencing a situation that could lead to suicide, harm to himself or someone else, to get them to resources quickly, not on hold for hours, which had been the case in some instances, but immediate access to a human voice and then hopefully a healthcare provider in their community. Those are very important steps to really getting ahead of this 22 a day average suicides among veterans, majority of which are Vietnam veterans. So we have to understand also the base of veterans who are most at risk and make sure that we have resources that are attuned to those issues.
I know we're lucky to have one of the call centers in North Carolina, in Greenville, for the suicide prevention side of things. On DC level, on the national level, what can be done on that level to kind of continue to move forward?
We have to continue to increase awareness, but again, for anyone who served in the military, whether they were discharged honorably or dishonorably, when it comes to their mental health and taking care of themselves and their family members, push the resources out to the community so that you can make sure that we have that opportunity at intervention before something disastrous occurs.
I know many people have confused mental illness and suicide as being the same thing. They're not always the same thing, and that, especially with their veteran population.
They're not, and actually I think we've also confused mental illness with what may be symptoms of something that had to do with repeated exposure to concussions, CTE, TBI, all of these things that are traumatic events for the brain that we're only now beginning to really understand the impact it can have on someone's behavior. We viewed it as mental health. They used to call it shell shock back in the Second World War and in the Vietnam War, but now the science suggests that there are certain jobs and certain circumstances that these soldiers were exposed to that are having an impact on their mental health. That's why we've got to do everything we can to help them.
Do you feel there is a way in the military to introduce mental health screening and mental health normality, I guess, that's not currently there, without causing the reprimand that has been in the past, where if you say you have an issue, you're kind of prevented from going forward?
Well, that's what we have to do better work with. I mean, we stigmatize this idea of mental health, but we also have to realize that these are not sort of choices the soldier's making. These are physiological conditions that they're struggling with, and we need to remove the stigma, provide a safe harbor for somebody saying, you know, I'm feeling a way that I don't think is good and potentially harmful to me or my family, so that they have a safe harbor and a trusting place where they can come to someone within the VA or within the Department of Defense and get the help they deserve.